talk about diabetic retinopathy, a common but preventable complication of diabetes mellitus affecting the eyes of people living with diabetes mellitus. With the correct awareness, early detection and timely treatment, it has been seen that most people with diabetic retinopathy go on to maintain perfectly healthy eyesight for life. So what is diabetic retinopathy? Diabetic retinopathy is a complication of diabetes mellitus which affects the eyes when there is a long-term exposure to very high blood sugars. There is damage to the very fine vessels in the retina of the eye. The retina is the innermost light-sensitive layer of the eye, and any such damage caused by diabetes causes impairment of vision or defects in the vision of these patients. So who is at risk for diabetic retinopathy? All patients with diabetes mellitus. Type 1 diabetes mellitus, type 2 diabetes mellitus, even gestational diabetes patients may go on to develop diabetic retinopathy. So what are the symptoms of diabetic retinopathy? It is very important to understand that in the early stages of diabetic retinopathy, there will be no symptoms. It is asymptomatic. However, in the later stages, these patients may develop symptoms like defect or blurring of the central vision, development of small black floaters in their field of vision. There may be loss of color sensitivity, and they may also develop sudden loss of vision. So how is diabetic retinopathy detected? Because it is asymptomatic or without symptoms in the early stages, it is very important for all patients of diabetic mellitus to have a comprehensive dilated examination of their eyes at least once a year. So the take-home message today is that diabetic retinopathy is asymptomatic, so screening is very critical in its detection. And with good control of diabetes and timely treatment, diabetic retinopathy effects on vision can majorly be prevented. So I urge everyone to encourage their family and friends living with diabetes to undergo regular comprehensive eye examination. Thank you.